of the holiday season, COVID cases are rising across the world. With the emergence of the new JN1 subvariant in the US, China, and Singapore, precautions have been put into place. One case of the new variant has been found in Kerala, due to which Karnataka has taken precautionary measures. Karnataka COVID-19 Technical Advisory Committee will meet on December 19th. The Union Ministry of Health has already started preparedness and mock drills. Karnataka government has made it mandatory for people above 60 years and people with comorbidities to wear face masks. But what is this new variant and what precautions can keep us safe? Let us talk about this and much more with our guest, Dr. Haleema Yezdani. Dr. Haleema Yezdani is a general physician with over 2 decades of experience. She is the Vice President of India chapter at Healthcare Information and Management Systems Society. She is one of the future 50 clinical leaders globally selected by HIMSS. Let us talk to her to know more about this. Thank you so much, Doctor, for doing this with us. So firstly, can you tell us what is this new JNI subvariant of COVID and how is it different?
Okay, this particular variant is a subvariant of Omicron. It is no different from Omicron. The similarities in the presentation is almost 90% the same. Basically, what happens in this particular variant is there is a particular mutation which is happening in the spikes. I'm sure everyone remembers the COVID virus. That's the structure of the virus with spikes from like a cartwheel.
Yeah.
So there is one single mutation in the cartwheel in the spike that basically has the capacity to adhere to the lung tissue of the human being wherever it gets attached. So that adherence is what basically will impact the spread. So when we're talking about JN, the mutation of Omicron, we are going to might have an extensive spread of the same variant because of the particular thing which I told you. The attachment on the spike is more prone to Omicron and this particular variant, and because of that, I would say the attraction and the attachment to the human lung, the spread can be extensive. Okay. And that's about things, but it's a mutated variant. So actually, just keep in mind that any virus, for that matter, after mutation is not as strong as it was.
Oh, in the initial
stages.
Yeah.
Okay, so we had Delta. I'm sure we had Delta, which is really a catastrophe and a humanitarian disaster. So after Delta, the next wave was a slower one or lesser, thing. But when the second wave spiked up, the second mutation was still stronger, still the same as Delta.
Yeah.
But when Omicron came up, it mellowed down because already when Omicron started up, mutations were extensive. Mutations is something that the virus keeps changing its stature, its its behavior. Its assembly, it kind of goes on mutating and changing. So what we have now is after multiple mutations of Omicron. Okay. So I presume it will not be strong. It will be weak, but it can spread more.
So here, what you mean is that this variant, it can spread more, but it might not be as deadly as COVID was when it started.
Not as deadly as Delta. But yes, we can have more people getting infected.
Yeah. Yes. So can you tell us what are the symptoms of this variant and about that?
Yeah, the same thing what I think all of us know about COVID: fever, cold, cough, muscle pain, low back pain, diarrhea, abdomen pain, cramps, weakness, fatigue. Of course, the last is the breathing difficulty, uneasiness, chest pain, all that. So it comes with the same significant symptoms, but the intensity of the symptoms is much less compared to Delta.
Okay. So it might seem like viral.
Yeah, that is what is going to be a very difficult situation. It might seem like influenza. It may seem like any kind of normal viral illness. Yeah. And it could be a variant of Omicron, that is JN. Yeah.
Oh, okay. So how do we deduct it? Usually in this weather, especially because it's winter and southern state of India is already going to see a huge rainfall in that.
Right.
So it's very common for people to have normal cold these. So how can people differentiate, because they might not go to the doctor every time. Right. They might not be able to afford, a few people cannot.
See, let me tell you what we usually follow. Yeah. If someone comes to me with a fever, headache, cold and similar symptoms as COVID and influenza, we usually give them the normal medications. We don't start with antibiotics and directly. We give them decongestants, we give them symptomatic measures and wait for 48 hours. Okay. If symptoms continue, then we add on, thinking there could be a mixed infection, we add antibiotic. Wait for 24 hours. But the spike continues, the body pain is worse, lung symptoms are more, desaturation comes up, then we say yes, we have to investigate. And I think the only way of knowing it is swabbing as usual and getting the CBC done.
Yeah.
That will give us a picture after that. So with symptoms, it is very difficult to differentiate between the two. because aches and pains happen in influenza too.
Yeah.
But in this variant, basically the low back pain is quite predominant,
Okay, so that's
which is
something
again
people
that
can look for.
yes, yes. And there's another kind of overlapping thing that is common in dengue as well.
Yeah.
But the chest symptoms are less, so maybe that's why we can differentiate.
Bit of-
And the confirmation, of course, is by swab test.
Yeah, the testing. So can you tell us who are more prone to this variant?
This so far looks like a milder form, and we're not having things which are really going offhand. But elderly people, people above 60 years, people who are basically on immunosuppressants, there are certain ailments where they require to take immunosuppressants, so they have to be extremely careful. Uncontrolled diabetics. Children are, though they're not very prone, they don't catch it very easily. But yeah, if they are weak and if the immune system is not very strong, so they can be pretty careful about this. HIV patients who are on full-blown thing, they have to be extremely careful with this particular variant.
So can you tell us what could be some of the precautions that people can take in general?
Right. So basically, I think we already have gone through precautions time and again, and this time of the year that we have to get back on our masks, especially the elderly people who are above 60. I definitely, in fact, I urge them to wear mask whenever you're going out in public. There is a WHO thing that they say triple layer mask is required, but I would say at least a single layer. Though triple layer becomes difficult for the elderly to wear, they feel the suffocation and all of that. But yeah, at least a single layer mask if you are out in that crowd, extremely important at this point.
Yeah, the
in
government
time.
has already made it
So we already
mandatory.
have a mandatory out there for that. Wearing a mask, then staying away from people who are infected. It's very difficult in this season because the Bangalore climate is changing and we're already in winter. There are a lot of people who are infected with cold cough. Try to stay away. And the third and the most important thing which I have told time and again during all my interviews is hand washing.
Basics.
I think I just cannot tell the significance enough. I cannot emphasize it enough that how important hand washing is to prevent all these things. Hand washing is not that you go, you wash and you come out. No, there are steps of hand washing, which is very important that we adhere to, especially when keeping this way in mind. I'm sure all of us know the front to front, back, interlocking, rub this, then go with this, encircling your tips of the finger, the thumb, and lastly the wrist. The same thing after soap application, the same sequencing while washing with water. So then you can be germ free. That's how it goes.
Proper hand washing.
It has to be a definitive hand washing to prevent any kind of infection from spreading from person to person.
So these basics from wearing mask, proper hand washing and maintaining the distance can help a lot of people.
It can definitely help and can go a long way in helping people who are really ill and already suffering. So it will not kind of make them prone to.
Also, one more thing, during COVID, we saw a lot of people trying home remedies, be it kahda, haldi doodh, and those sort of things. Of course, it's good for health, but does it should they keep doing this and waiting for a while before they visit the doctor?
See, no. If there's already symptoms which have come in, I would recommend them to have a word with the doctor. Can be through telemedicine, can be via phone call or in person or whatever way they want the consultation to be. But the first word has to be from their physician. But home remedies, even before it starts, see, already you have a wave which is going to come in. We know that we're going to be prone for it. Then, yeah, home remedies do work to ward it off a bit. You can use that, but not as a treatment, of course not.
So, even if they start getting the symptoms, they should at least consult the doctor as soon as it's possible.
Unfortunately, I have seen many people who basically do this, and it's really wrong. They go to the chemist, they tell their symptoms,
and don't know.
And whatever medicine the chemist gives, they don't even ask for allergies. They give it just like that. They just eat it and then they come back with complications. So I think just one phone call to a doctor who is known to you, or telemedicine platforms wherein doctors are there to give advice to you. Talk to them, talk to a qualified doctor, and then take the medication. I always urge them for that.
So, of course, these are some of the precautionary measures that our viewers can take. But apart from that, can you help us understand why is there a rise in cases again? It's been almost 2 years since COVID happened.
Right.
So why does such mutations happen?
See, when the COVID, the last wave occurred, as Omicron, and everything was open, and people started mingling around, and things started increasing. Travel, trade, everything increased and went back to normalcy. So with that, I'm sure after we had the vaccinations and all that as well, the virus is not keeping quiet. It's not going to just end and stop there. So it has been changing, mutating. So one form of virus which had this adherent capsule on it has clung on to us. So it is there with us. I mean, COVID has not gone anywhere. It is there with us. It's changing its shape and size. So this particular shape which has come in now is human prone. So that's why we've got it again.
Okay. So, can in the future also can we have more of such mutations? Can we
See,
expect it?
yes, any virus before it dies down has mutations.
Okay.
It's a normal life cycle of the virus. Doesn't just go like that. It changes its shape, its size, its structure, mutates up to a point it gets weaker and can't mutate anymore. Till we reach that stage, we can expect waves like this.
Okay. And you also spoke about vaccination here. So, will the COVID vaccination that people took, will it stop? Will it help them?
See, as per the mandates, it should help and it should be, is useful
Yeah.
in controlling. Yeah, I think yes, better to go in for that. But then, yeah, I mean, much less.
We are not sure
yeah,
at this point.
at this
what it-
point, I think the investigations are still on.
Yeah.
So we can't be clear about that.
Okay. Yeah. And lastly, is there any message that you would give to our viewers for the health precautionary or other things that they can
yes,
take?
I
ahead of
understand.
this?
I understand we are going to have the new year around the corner. We have Christmas going on. There are parties and celebrations going on. I would definitely tell the people out there, be very careful. Though it might not, kind of cause admissions. It might not. We are still not sure how bad it is going to be. But precaution is always better than cure. Prevention is always a safer bet. Wear your mask. Don't forget. Don't take your elderly people out. Don't make them prone for the virus. Wash hands if you're touching any surfaces which are, could be contaminated, and keep away from people who are infected. Having said that, it gets difficult. As I told you again, in this weather, it's really bad and difficult to kind of stay away. But then precautions are very, very important. Keeping in mind that the virus which is coming here is mutated, it is weak, but it can spread aggressively. So if I have a crowd out there in the New Year and in Christmas party, which is going to be, kind of maybe in thousands, so this will multiply again by numbers. The transmission can just happen out there. So be very, very careful. Wish you all a very, very happy New Year and a great festival time. But be extra cautious during celebrations. Thank you so much.
Thank you. Thank you so much
Thank
for
you.
doing this, ma'am.